Good morning, everyone. We're going to wait just a couple minutes and see if we can get a couple more people on. There's been a couple accidents this morning and a fire and whatnot, so we'll just give people just a little bit more time today. So start in about 2 minutes. All right, we'll get this started. Good morning, everyone. Happy Friday. We made it. Yay. Bear with me. I was at a conference all week, and so my nurses put these slides together and I'm giving the PowerPoint. So I'm going to do my best that I can today. All right, let's get into it. So we got a pretty picture here. I love our pictures. Okay, who we are, this one hasn't changed, our 7 counties. What we do, our mission and vision. And we have a new slide. This is our Two Rivers Public Health Department nursing team. So on my left, I guess, there's the staff that we already have in place. They have been here a little bit. So Jacki Connery, that's me, community health nurse supervisor. I think everybody knows Susan Puckett, who's also a community health nurse. And then we have Rosa Pinion, a program nurse, and Marilyn Warnken, and she's also a program nurse. We do have a couple new additions. So Rita Call, she just came and started about 2-3 weeks ago as a community health nurse. And then on Monday, you guys might be seeing a new face, Liz Weens. So she's starting Monday. So we just thought it'd be nice to put some faces with the names that you guys see. All right, this is just a reminder that we're Region 7. You can see where Nebraska is. All right, COVID by the numbers. So total US confirmed, we're at 79,991,833. 7-day average per 100 is 52.9. Total US deaths, 979,108. Total region 7 confirmed, 3,365,716. And total region 7 deaths, 40,004. So for Nebraska, we're at a total confirmed of 477,724 and a total deaths of 4,162. Kansas doing a little bit worse than us. Total confirmed 770,275 with 8,397 deaths. Missouri's leading us. Total confirmed 1,411,722 with 19,993 deaths. And Iowa with total confirmed 759,048 and 9,445 deaths. We have our map over here, and usually we have our 7-day case rate per 100,000. And I don't see those numbers on there. So before we send this out today, I'll get that updated for you guys. This is the Two Rivers Public Health Department dashboard. So you can find this on the Two Rivers website. We have 2 different screens from that, this one and the next. So pretty much takeaway from this is that we keep going down. So that's amazing. We're still in the green, yay. And our little risk dial indicator has decreased even more. And our district daily case rate per 100,000 is at 1.0. So awesome. Cumulative deaths as of March 30th, still 205. This next one is also something that you can find on the Two Rivers Public Health Department website. And this is for the hospital data. This is from April 7th. And pretty much the same as the last slide is all of the different tables. You can see that we are decreasing. So we're still on a decrease, which yay. And then our EEI, which is the other table on the right, we had a change in our total med-surg beds that increased, and our total ICU beds available that increased. But I mean, when you really look at the data, we only have 1 total ICU COVID patient out of 10. And we have 3 vents in use, and none of them are being used for COVID. So that's a great takeaway for today. I'm going to take that. Okay, our COVID data tracker weekly review. So this one is on added protection. So as the county emerges from the Omicron surge, we experience low COVID-19 community levels in most part of the country. The CDC has updated its COVID-19 vaccination guidance to give some people the option to get a second mRNA COVID-19 booster dose with the Pfizer or the Moderna. So you can now receive a second booster dose if you receive the Johnson & Johnson vaccine as both your primary and booster dose at least 4 months ago, are ages 50 and older, and received any booster dose at least 4 months ago, and are moderately or severely immunocompromised, ages 12 years and older, and received any booster dose at least 4 months ago. So we are working on getting our standard orders signed. That way we can offer this booster dose at our clinics. So always good information from the CDC. This next one is about Nowcast. It is a model that estimates more recent proportions of circulating variants, enables timely public health action. So the CDC is providing weekly Nowcast estimates which will be updated every week on Tuesday. So these are a couple different tables that show you the variants that are coming through. So the light pink is the Omicron BA.2, and the purple is the Omicron B.1.1.529. The orange is Delta, and the other is black. So you can see that on the left, that table is a lot of the Omicron with the pink and the purple, and just a little bit of Delta sprinkled in. So these are linked for you. So when we send out the slides, you can actually click on those and it will take you to Nowcast. Test to treat. So the new nationwide Test to Treat initiative provides quick access to free treatment for COVID-19. Through this program, people can get tested, and if they are positive and treatments are appropriate for them, they can receive a prescription from a healthcare provider and have their prescription filled all at one location. This one-stop test to treat sites are available at hundreds of locations nationwide, including pharmacy-based clinics, federally qualified health centers, and long-term care facilities. People can continue to be tested and treated by their own healthcare providers who can appropriately prescribe these oral antivirals at locations where the medicines are distributed. So you can do the call center number there, and they're available from 8 a.m. to midnight to get help in more than 150 other languages. And there's some links that you can click on there. And at the very bottom, there's the find location, and that is hyperlinked. So you can click that to find a location to join in on the Test to Treat initiative. This is a reminder. So it was sent out the other day that the distribution of, and I can never say any kind of medication, so I'm sorry, guys. Sotrovimab, that's how I'm going to say it today. So the distribution of sotrovimab has paused to all U.S. states and territories. So the CDC estimated the proportion of COVID-19 cases caused by Omicron BA.2 variant to be above 50% in all U.S. Departments of Health and Human Service regions. Due to this data, use of sotrovimab is not authorized in any USA state or territory at this time. So that's effective immediately. They have paused the distribution of sotrovimab. And there is a fact sheet there. And this is just a reminder that there are currently authorized alternative treatments available as well. And I am not going to say all those medication names because it won't be right. So I'm going to let you guys read those. But there are other treatments for antivirals to use with COVID-19. So I think that's really the takeaway. But there are hyperlinks in this as well for the fact sheets and to CDC, so you guys can read more on that. Okay, flu view. We continue. If you look at the map on the right, we continue to be in the low or that light green, which is minimal, sorry, not low. So that's great. We are not getting too high with our influenza. Sorry, anyways, key points. Sporadic influenza activity continues across the country. And in some areas, influenza activity is increasing. The majority of influenza virus detected is influenza A, which is the H3N2. And it says H3N2 viruses identified so far this season are genetically closely related to the vaccine virus. So that's good. So flu view, if you guys don't get on there, it's got a lot of information for you about influenza. It tracks it through the whole season, and you can actually go take that map and you can go back to a different week and look at what we were each week by week. So okay, the next two slides are about Nebraska suicide rates. So this is from 2016 to 2020, which is a 5-year average. And this one is the Nebraska suicide rates per 100,000 individuals. And those individuals are ages 10 to 24. So in our district, Two Rivers, we are at 11.2 per 100,000 individuals in the ages of 10 to 24. So you can kind of see what we are for the whole of Nebraska. And the overall average for Nebraska, we're at 11.4 per 100,000. And then you can see around Nebraska in the white, they have put the states that surround us. So Iowa's at 11.6, Missouri's at 14.4, Kansas is at 11.6, Colorado at 18.1, Wyoming at 20.8, and South Dakota, it's kind of squished in at the top right, is at 23.5. So our next slide, this is the overall. So this is all ages. So 2016 to 2020, 5-year average for Nebraska suicide rates per 100,000 individuals. So Nebraska as a whole is at a 14.4, and Two Rivers is at a 17.1 for our average. So you can kind of look through the other districts and see what the other districts' averages are for all ages. And then around the outside again, it are the states that surround us. So Iowa at 16, Missouri at 18.5, Kansas at 18.5, Colorado at 21.3, Wyoming at 27.3, and South Dakota up in the right-hand corner, 20.8. All right. So next we have Dr. Von Lutz to talk about LifeSmiles Dental Program.
Good morning, everyone. Happy Friday morning to you all. Just want to talk really quick about our LifeSmiles Dental Program. For those of you that don't know about that, we have a team that goes out to area schools and performs dental screenings. They check for possible decay on teeth. They make referrals back to local dentists. They also do fluoride treatments and sealants on molars. So this school year, the last 2 years, because of COVID, we have unfortunately not been out there. But this year we've been able to get back out. And so far, we do it in 2 rounds, kind of like a first semester, second semester. So first semester, we did 673 screenings, meaning we saw 673 kids pre-K through about 3rd grade. We did 515 fluoride treatments and sealed 1,723 teeth. So for second semester, since January, we have seen 540 kiddos for screenings, did 393 fluoride treatments, and 598 teeth have been sealed. We have made many referrals to the local dentist for additional care that these kiddos need. We have seen quite a few kids come back second round that have had treatment completed or at least started. So that is excellent to see. There's such a huge need for this program out there. So many kiddos that are suffering from poor oral health, that do not have insurance, do not qualify for insurance. So some of them, this is the only thing that they get. Now, this program is free to them. So the fluoride treatments and the sealants are done free of charge to the students and the families. The program runs on grant and donations. So we are always in need of donations to help promote the program. We did get an additional grant, and we will start a infant toddler program in May. So look for that coming too. So exciting things going on out there with our dental team. Next slide, please. Thank you. So COVID testing, as everybody knows, numbers have really gone down, and we have moved the COVID testing from the fairgrounds here to our office. It is available on Mondays and Wednesdays. Because of the numbers, we have actually reduced the hours too, and we do it for 1 hour twice a week from 9:30 to 10:30. Those requiring or wanting to get tested must register for a test at our website and fill in their insurance information and whatnot. If you have any issues, you can give our office a call and we'll be happy to help. Next slide. So this shows our COVID-19 testing. This started back, this graph anyway, back in October, and it kind of shows you, it goes along with the curve that we had, how testing really increased. In January of this year, we performed 1,059 tests. Now that is not including our partners out there, the clinics and whatnot. That is what we did through Two Rivers. In March, we only did 103. So as you can see, testing has really gone down, and that's why the hours have gone down too. So that, I believe, is all that I have for you, but we'll check the next slide just to make sure that they didn't slip something in on me. Oh, there we go, on the road again, the clinics. We do have our clinics coming up. Next week, we will be at the fairgrounds here in Kearney. Then on Wednesday, we will be in Alma. And then Thursday, we will have the VFC clinics here at the Two Rivers office. I know Jackie did mention that we are waiting for our signed standing orders so we can start giving that additional booster dose. As soon as we get those orders, we will be providing those vaccines, and we will be possibly increasing clinics if there is a need for that. So just stay tuned. Keep looking out on our website, trphd.org, and look at our schedule. Thank you, everyone.
Awesome. Thanks, Vaughn. All right, everyone, we will get to wrapping this up here. So we are having an accreditation celebration. So please join us in celebrating Two Rivers Public Health Department's National Accreditation Award. We are doing this on May 3rd from 1 p.m. to 3 p.m. So if you would like to come and help us celebrate that we are now accredited, please RSVP to 308-233-3100. We would love to meet everybody, and everybody can come and kind of walk through our building as we have kind of expanded, and it looks a little bit different than it has. So we are located at 516 West 11th Street in Kearney, Nebraska. So we'd love to see you guys. So just let us know if you're going to come. And then our last slide is our rainbow at the end. Beautiful picture. So we will let you guys have your time back for the day, and we will talk with you guys all next Friday. Thanks. Have a great day. Oh.